This is Dr. S, and we have a program every week for the people following my program. Today, our subject is hypoglycemia. Hypoglycemia is abnormal low blood sugar. Symptom maybe you experience is person to person. It can be symptom like fatigue, weakness, hunger, palpitation, headache, agitation, cold sweat, and sometimes constipation. Symptom can be different throughout the day. In early morning, patient with the hypoglycemia feel fatigue, shakiness, and headache. Between the meal, they experience foggy mind, depression, anger, crying spells, and profuse perspiration. Hypoglycemia is not a disease, it's a condition and maybe become a disease later in life as a diabetic. We have two types of a hypoglycemia. The first one is a primary hypoglycemia, which is overproduction of insulin. The secondary hypoglycemia is caused by diet. Usually nutritional deficiency, excess alcohol consumption, and food sensitivity. The food we consume throughout the day is due to lack of fiber and a large amount of a carbohydrate. If you have any of those symptoms, you should see your doctor, and based on some sign and symptom and diagnostic tool, they will be able to help you. This sign and symptom, as I explained to you, this can be a fatigue, headache, agitation, and many other. The next component, they have to check the adrenal gland or adrenal function via orthostatic blood pressure. Since aldosterone control the blood pressure, the rule of a 20-10-20 will tell us it is how the blood pressure is. For a female blood pressure, it is 100/80, usually that decrease, and for a male is 110/80. The rule of a 20-10-20 means systolic blood pressure drop 20 mmHg, the diastolic increase by 10 mmHg, and other 20 it is increase of a heart rate 20 beat per minute. Whenever we check for adrenal function, adrenal has two components, medulla and a cortex. In a cortex, which is produce cortisol, which is affecting the glucocorticosteroid, which that component is manage your glucose of your body. The other component of cortisol, it can be anti-inflammatory. Cortisol has a many functional system. Whenever your adrenal become fatigue, majority of the people in this society, they are adrenal junkie. Why we call them junkie? Because constantly they're activating their adrenal to feel better. If your adrenal become fatigue, will affect your blood pressure decrease, follow with decrease of a blood flow, then will decrease the brain function because the sufficient blood is not going to the head. And from there become decrease of a cognitive, which is that for the people when they are hypoglycemia, they feel brain fog. The test which is you need to do, or your doctor need to do, or when you go see them, they will do, it is a cortisol AM and PM. It can be saliva test too. They don't have to be draw the blood. Do the blood sugar test, fasting, and also 2 hours plus 6 hours glucose tolerance test, GTT. HbA1c, AEG, and also insulin. Those tests tell us the function of our system as far as the sugar and insulin and the function of a cell, how they monitoring those sugar to generate the energy. What we can do for hypoglycemia, the hypoglycemia can be prevented to become diabetic in further in your life, which is caused diabetic. Exercise is great, but in moderate, because exercise it causes adrenal insufficiency. Decrease the salt intake. Aldosterone job in our system to hold on salt. More salt, more blood pressure. And if using salt, use a sea salt and get it with iodine. The iodine completely different component. We can talk sometime in future program. Support your adrenal gland by checking some of the hormone like DHEA, and some of the food like a licorice can be good for adrenal. Decrease caffeine intake. Caffeine stress the adrenal gland. The same thing, sugar. Decrease your sugar intake. Sugar can be in many different form, which is our body get it throughout the day. When we say sugar, everything just a sugar. If you give a choice to the body between alcohol, sugar, protein, fat, body will take the alcohol first because it's already digested food, is a sugar ready to be used. Also, sugar will stress the adrenal gland. Avoid alcohol because that's a pure sugar. When you drink alcohol, your beta cell in your pancreas secrete more insulin to get that sugar to the cell. As we age, those beta cell in the islet Langerheim of our pancreas start decrease to the secretion of insulin. You become insulin resistant. Then you become diabetic. Eating more frequently for the people of hypoglycemia. is suggested. Taking chromium 3 times a day if you're eating 3 meals a day in a heavy meal. Not every time you eat something, you don't mean you have to take a chromium every time. The program I have in the TV or in the YouTube, which is you guys watching right now, it is not the place for you take advice as a place for your health. This is just a program, just information. All the information you get, you can share with your physician, and they are the one, they have to make the decision what is right or not. If I give you some advice, it's just the information for you, is not intended to be using as your health advice. Vitamin C is essential for adrenal. Using niacinamide absorb better, and you can use the non-flush, because when you use a niacin as a B3, some people have the adverse effect of the flushing. The niacinamide have a great help to get the adrenal gland and also the pancreas. Use the low glycemic index food. You can go online and see what type of food is low glycemic. That's very beneficial for hypoglycemia people and also diabetic. I was reading an article that diabetic increased by 40% in past 2 years globally. Unfortunately, people become diabetic. It is a self-inflicted wound. It's mean the things we cause our blood sugar spike that high. Beside of a percentage-wise, some people have a genetic predisposition, those different. But majority of people, they are the one causing become diabetic. And also consider a food sensitivity test. And usually your insurance do not pay for that, pay from your pocket, which is that can help you in a longer part of your life do not become diabetic. Hopefully you have a great day. I will see you till next time.